Good afternoon. Welcome to today's webinar, Using Health Impact Assessment to Improve Our Communities, hosted by the Smart Growth Information Clearinghouse. My name is Michael Bayer. I am the Manager of Infrastructure and Development at the Maryland Department of Planning and Project Manager for the Smart Growth Information Clearinghouse. The Smart Growth Information Clearinghouse is a project of the Smart Growth Network and is partially funded by the U.S. EPA Office of Sustainable Communities and managed by the Maryland Department of Planning. In addition to hosting webinars like today's Using Health Impact Assessment to Improve Our Communities, the Smart Growth Information Clearinghouse has a website, smartgrowth.org, which is your one-stop on the web for the most current information on effective growth, development, and preservation practices. We provide timely news and information about events, funding opportunities, awards, and resources to help local decision makers foster healthy, resilient, and economically vibrant communities. The Clearinghouse is also the virtual home of the Smart Growth Network, a nationally recognized coalition of leadership organizations that have formally endorsed the principles of smart growth. This webinar is one in a series of webinars produced by the Clearinghouse on smart growth topics, available for viewing at smartgrowth.org. We will be recording this webinar and will post it on our website. We encourage you to visit our website and subscribe to our weekly e-newsletter to get the latest nationwide information about smart growth and to learn about upcoming webinars. You can also find out about other planning initiatives and educational opportunities in Maryland by visiting the Maryland Department of Planning's website at planning.maryland.gov. Viewers of this live event are eligible to receive 1.5 CM credits from the American Planning Association. To log your CM credits for this webinar, log into your account on the American Planning Association's website and search the name of today's event, which is, again, Using Health Impact Assessment to Improve Our Communities. Also, event number 913-5565. This webinar has been approved for 1.5 CM credits for live viewing only. So today we're excited to present Using Health Impact Assessment to Improve Our Communities. In today's webinar, we will discuss how the use of health impact assessment has grown over the past decade, with much of the practice taking place in response to proposed policies and projects in the fields of urban planning and transportation. We will review how HIA has been used in planning and how you can apply the principles of the practice in your everyday work. Our experts today are Anna Ricklin and Jackie Forbes. Anna Ricklin is the manager of the American Planning Association's Planning and Community Health Center, where she oversees applied research and place-based initiatives to advance health-oriented planning practices. She has a background in health impact assessment, active transportation planning, and cross-sector collaboration, and her recent work has focused on healthy planning metrics and comprehensive planning for health. Anna holds an MHS from the Johns Hopkins Bloomberg School of Public Health and is based in Washington, D.C. Jackie Forbes serves as a senior transportation planner for the Kane County, Illinois Division of Transportation. In her current position, she is responsible for transportation planning and programming activities related to highway, transit, and bicycle pedestrian facilities. In her prior job, she was a health planner for the Kane County Health Department, where she guided 2 community health assessments, completed an update to the department's Community Health Improvement Plan, and conducted 2 health impact assessments. Jackie also served on the National Association of County and City Health Officials Health Impact Assessment Community of Practice team. She has a BA from Miami University and an MS from DePaul University. Following the presentations, our presenters will answer as many questions as time permits. You can ask a question anytime during the presentation using the questions tool in the control panel located on the right side of your screen. Now I'll turn it over to Anna to get us started.
Great. Thank you for that introduction, Michael, and it's really great to be participating in this webinar today. Please let me know if you can't see my screen, but hopefully you can. For those of you who are joining from Maryland, actually my first job out of graduate school and my first job in as a public health professional working in planning in the built environment was at the Baltimore City Department of Transportation, where at the time we were facilitating the planning of the Red Line project, which has since been decided not to move forward or be built. But this image here on my cover slide is actually a picture I took at one of our public meetings where we were illustrating to the community the alignment options and where the station areas were going to be. And I actually did a health impact assessment on the Red Line during my time with Baltimore City. So this picture actually illustrates some of my own history as well as some of the history of health impact assessment. So here in my current role at the American Planning Association, I manage our Planning and Community Health Center, which, just briefly to give you an overview of what we do here, is advance plans and policies for improving the built environment with public health strategies, and vice versa as well, trying to build relationships with the public health sector across the country to use planning strategies to improve health. And the way we do that is through applied research, bringing people together and illustrating to our members what that looks like, so sharing case studies and lessons learned from around the country. Our primary areas of focus have been active living and food systems and health and all planning policies, and that's where our health impact assessment work really fits in. So beginning with a definition, although many of you might be familiar, here is a definition. There are several definitions of health impact assessment. But I think the most important thing to understand is that it's systematic. There's 6 steps that you are walked through, and you're assessing a very specific proposed action. And in this case, we're looking at plans, policies, or projects. And you're looking at multiple data sources and involving a number of stakeholders. A key component of health impact assessment is community engagement with not just residents, but also other stakeholders in the community, organizations, businesses who have a stake in the outcome of the decision and the implementation of the decision. APA was funded a few years ago by the Pew Charitable Trust Health Impact Project, which is a collaboration between Pew and the Robert Wood Johnson Foundation, to do research on how planning health impact assessments have taken shape in the U.S. Over the past decade. And so we defined these 3 domains of planning decisions as plans, policies, and different projects that planners would be involved in and that would be in the scope of planning to engage in a health impact assessment. So obviously, many of you know what a plan is and what a policy is, but we thought it was important to define these for the project, for our project. And then, of course, a project is an action undertaken to implement the plan or policy. So I guess the key takeaway here is that HIA can take place at any step in the process, and I'll be reviewing some more on that. So there's 4 different basic types of HIAs. There's a rapid HIA, sometimes it's just weeks or short months, often involving less complex decisions and generally involving literature scan, maybe some secondary data analysis, maybe a little bit of outreach to the community, but not much. A rapid HIA, a desktop HIA is the same thing, but without the stakeholder engagement of any kind. And when you're thinking about the rapid or the desktop HIAs, it's important to consider the benefits of engaging community or not engaging the community and the cost of time necessary to do so. So I think it's not just cost, monetary cost that leads people to do these rapid HIAs or desktop HIAs. It's also the other kinds of costs, time costs, and maybe the decision is imminent. You learn of the decision in a very short period of time, and so have to do this rapid HIA. There's not enough time to really engage the community or stakeholders. And they also focus on a more narrow set of topics because of the necessity of not taking a lot of time. An intermediate HIA is one that involves slightly more time and resources, usually takes a few months, more complex scope, and there's a more detailed analysis, so you're just going deeper. And then a comprehensive HIA, which I believe that Jackie is going to present to you after this as a deep dive case study, often takes much longer and does involve collecting new data, often going to the community and really understanding what their situation is and how the potential plan or policy or project could affect them. So these are the steps. These are the 6 steps of HIA, and I'll walk through these in a little bit. So there's screening. Are we going to do the project? Are we going to do an HIA on this? Just asking that basic question. And I like that the process for doing HIA involves the step of asking, should we do this or not? I think it's an important thing before diving in and taking on something that you might not be familiar with. Scoping, just laying out the different issues, assessment, of course, and then coming up with recommendations and then reporting those recommendations, and then ideally looping back and monitoring and evaluating the impact of the HIA. And I'll go deeper into this later on. So the first project we did with Pew was to actually analyze a number of HIAs across the country. And these were all of the different planning-related HIAs that we looked at. We did a number of case studies and in-depth reviews, and then just kind of counted up all of the HIAs that we could find that related to planning questions. And I want to note that we actually excluded a number of transportation HIAs because that has been a field unto itself. So for example, the Red Line, the HIA on the Red Line project, light rail project in Baltimore that I did was excluded from this list because it fell squarely within the transportation category. So we were really looking at land use primarily. So over the decade, and our set was between 2004 and 2014, we saw a significant rise in the number of HIAs completed, and that's due to a number of factors. One of them, obviously, is that there was increased funding to do HIA, and so that was a key driver of more communities taking on these questions. But it was also a shift in culture and a shift in how planners and their partners in the public health field were thinking about the health impacts of plans, policies, and projects and the built environment, changes to the built environment. So I like, we just display this graphically to see the rise. And then we did see you know, a slight drop, but not really. And I think that illustrates that there was less funding in the past few years for health impact assessment, as the kind of proof of concept was shown from the funder's perspective. For example, the Health Impact Project at Pew, which has an amazing database of all of the HIAs that have been done in the country. The proof of concept was shown to be effective. So I think that their hope was that more communities would begin to take it up without external funding. So within the planning field, we saw, so over that decade, we saw that there were about 350 HIAs completed in the U.S., and a third of them related to planning. As you can see, the majority of them were assessing a plan. About a quarter of them were looking at planning policies, and then some of them were looking at projects. And I think that, again, reflects that we excluded the majority of transportation health impact assessments from our pool, and I would say that the majority of transportation HIAs do focus on specific projects, corridor projects, highway projects. And then there's the straight count of the number of HIAs that we looked at. So we had just a couple of case studies to illustrate for you before going into the more details of how to do HIA. So one of the projects that we looked at was the Atlanta Regional Plan, which was one of just 4 regional plans that were that we found in our set of over 100 planning-related HIAs. So in the Atlanta Regional Plan 2040, it connected land use and transportation, and it was multiple jurisdictions in the Atlanta area, and all of them had different scales and sizes of government. As you probably are aware, Atlanta is a complex region. And so they had, part of the Atlanta Regional Plan was to kind of bring together all of the local plans and find commonalities between all of the different jurisdictions. And quite honestly, it was a very difficult HIA to complete. When we talked to the people who actually did this HIA, it was to mixed results. I think it was an example of potentially biting off more than they could chew on this HIA because of the different kinds of data and the different kinds of stakeholders that were involved. It's much easier to do a health impact assessment on a smaller scale plan or policy than on something regional, which is why I think we didn't see a lot of regional HIAs. But nonetheless, it was really interesting to see how they had brought a bunch of different kinds of information together to connect transportation and land use and the health impacts of planning in a more sustainable and smart growth-oriented way. And overall, the Plan 2040 was seen to show positive benefits for health, but it was really difficult to measure over the long term how they would track that. So that is just one example of an HIA. And then another example, which was on a more discrete jurisdiction, was the Plan OKC HIA. And Plan OKC was actually adopted in 2015. The HIA was done the prior year, and Oklahoma City had not done a comprehensive plan since the year 2000. So they had over a decade in between. And while this is not necessarily a pretty slide, it does show that the different components of the plan that they were assessing. So they had a number of scenarios that they were looking at, and on the bottom table you can see how they were thinking about positive and negative impacts on health. And this is often how HIAs are done, with just simple arrows up or down or neutral. Will the land use mix that's proposed in scenario A have a positive impact on health? Probably not. But scenario B and scenario C see increasingly positive impacts. So laying out using data, literature, to bring together information on how a specific policy might impact health can often just be illustrated this way. So after doing some of that research on how health impact assessment has been used in the U.S., we then developed a toolkit on for planners, for you, to actually implement and apply health impact assessment in your work. And these are the different sections of the toolkit that I'm going to walk through. And the first thing is we identified a number of core values that link health impact assessment to the field of planning and why HIA is really important for the field of planning. So the first thing is that HIA and planning themselves share a number of core values. HIA is a flexible tool, and it's another method available for planners to break down complex issues using data and community engagement, which you're already doing, but maybe not looking at health data, or maybe not engaging health stakeholders in the community engagement. So it's really just an expansion of what planning is already doing, the methods of HIA. And the second one is that HIA process often mirrors best planning practices. So like I just mentioned, HIA relies on best practices from planning to think creatively and innovate with new partners. It can bring a fresh perspective by providing an opportunity outside of the normal roles and responsibilities of more planning agencies. HIA illustrates a number of connections between health and planning. Obviously, that's its purpose. But because you're engaging experts with different specializations as well as community members, HIA can actually improve planners' ability to communicate effectively with multiple audiences using the clear, plain language that's necessary to reach those audiences, to describe some of the complex relationships between health and planning. And I think when you're doing community outreach, having a tool that helps you translate between health and planning is really useful. Health impact assessment catalyzes and fosters cross-sector collaboration. You can see a theme here. Because of the outreach that's required in especially the intermediate and more comprehensive approaches to HIA, it can really enhance existing collaborative networks, provide an opportunity for collaboration in new ways, and also enable groups with seemingly little common ground to work together on a common effort. And like planning, HIA is evolving. It's appropriate for a diverse set of issues, from comprehensive plans or financial plans, food systems ordinances, and as well as major infrastructure projects. But the practice itself is evolving, and that's why I sort of tend to title this presentation From HIA to Health and All Planning, because the goal is not necessarily to always do a responsive or reactive health impact assessment, but to see how the tools and methodologies of health impact assessment can inform planning and be more integrated into the planning process. So here's another illustration of the steps of HIA. Thanks to Jackie for sharing this with me. Showing them rather than in a linear set of steps, more in a cyclic set of steps where the monitoring and evaluation is linked back to the beginning of the process, which is very similar to planning, where the beginning of the planning process, you go all the way around, your plan is adopted, and then you're looking again at how we can improve it a few years later. So first two steps are screening and scoping, and I mentioned that I really like that screening is one of the key elements of doing an HIA, because it allows for some self-reflection about why are we doing this? Why is this an important decision to target for an HIA? What are the health issues that we're worried about? Is this just run-of-the-mill sort of, is this an air quality question that could potentially be addressed in another way or through regulations that already exist, or is this actually an important issue that can be brought up through doing this HIA? Who are the decision makers that we're targeting? Who will be involved? Do we have the capacity to do this? And not just how will the products be used, but how will your organization use the results of the HIA? So that's an easy-to-use checklist here. And then scoping expands upon the answers to your screening question, assuming that you decide to move forward. And that's where you decide on your research questions. You clarify roles. Often the health department or a local organization that is focused on health is involved in doing some of the work of the HIA. And you outline your goals for stakeholder engagement. You define your timeline and to what extent and to which groups you plan to reach out to. So this is the assessment phase, and this is a little bit complex, but it's also really what the nuts and bolts of assessment are like. When I first did the HIA on the Baltimore Red Line, assessment is where I got stuck, and I think it's where a lot of people get stuck, because it is really hard to bring all the information together on understanding what the impacts are going to be. And this is where you really must rely on literature and weigh the evidence of the associations between the proposed decision, the policy or the plan, and health. And so this is not, theory. This is supported by generally academic research, as well as maybe data from your own community about what the impacts are going to be of a particular planning question. And then, of course, you want to understand what the baseline conditions are in the community that you're working in. And it might just be one small neighborhood. It might be, in the case of the plan OKC, the entire city of Oklahoma City. And so there's quite a lot to consider here, and this is definitely what takes up the most time, obviously, in doing a health impact assessment. And this, I like this chart because it's laid out, this is, by the way, from the Douglas County Health Department, zoning for walkable mixed-use neighborhoods was the question here. And they have proximal impact. So thinking about a logic model, essentially, or what are the near-term outcomes of developing, putting a policy in place to establish walkable mixed-use neighborhood districts, and what does increased density mean for people's behavior, people's activities? It means decreased distance between destinations, but if you look at the arrow that goes straight up from there, it means that automobile trips are shorter, but it also means that people might still be driving. Does it mean that people won't be driving anymore just because of increased density? So there's a lot of different questions to consider, and how the impacts actually happen on both the environment and eventually the health of the people living in that environment. And then the far right are the potential health outcomes that we could see that are mediated by these other factors. So mapping out, we call it mapping out, essentially, all of the different elements that you'll be looking at. Once you've done your assessment, you come up with recommendations. And again, here's another checklist. I copied this from our HIA toolkit. So if you were to download the toolkit, you would have access to all of these different checklists that we included here, and I hope that we can share both the links and the documents themselves during the webinar. But thinking about the appropriateness and the relevancy of the recommendations, do they match what you heard from the community? Are they based on evidence? So this is a check, once again, for you to see, did we look at the data available, the qualitative data from people and the input we received, as well as the paper data. And are these recommendations feasible? Are they going to be implemented? Are decision makers going to receive them well? And that doesn't necessarily mean that you only have to put things down that decision makers will like, but is it something that, if persuaded, they could take action on? We'd all like to disassemble highways, maybe not all of us, but for example, but is that really a realistic recommendation? And where does the money come from? So thinking about that when you're laying out your recommendations, and when you're even in the process of doing the assessment, trying to stay on track towards the product that you're going to deliver at the end of the day, that you're going to report on. So staying focused on the specific proposal that you're actively considering, so that not only your assessment, but then the recommendations are very specific to that proposal. I think that's one of the key, most important things about HIA is staying focused on the particular question at hand. It can be tempting, especially when you're engaging with community, to expand your scope and think further than what the specific policy is talking about at that time, but staying focused on the policy is really very important. And then looping back to monitoring and evaluation, of course, once you've put your report together, you've shared it, you've disseminated it to the right people, and I also want to note that it's very important to, especially if you've engaged with the community, to report back to them about what the recommendations are, the results. If certain aspects of the plan, policy, or project will have positive or negative health impacts, and then what the recommendations are. Very important to report back to your stakeholders and to the decision makers, and then watching to see the impact. And I think keeping it in front of decision makers' eyes, reiterating it, not letting it just be reported once and then disappeared is an important component. But also going back to the community and having them be advocates is also really important. And this is where I also think planning can learn from public health, because public health has done such a good job on evaluating their programs, and planning has less of a history of that. So when you're selecting your data indicators and the instruments for collecting data, think about how and what you will monitor and evaluate over time and the impact of the project. So I put an image here from an HIA that was done in Nebraska, where they assessed how much of their parking was used even during the peak times, and saw that they had a lot of land use going towards parking that was not even being used. So they identified this as one of their key indicators, and one of the recommendations was about repurposing some of this open space to other uses. And they did that obviously through illustrating through the data, and mapping, but then following up with monitoring later on. It was a really, really easy one to track. And then thinking about short and long-term impacts, what is the potential change to the policy right now that you could affect? And then, of course, longer term, what is the impact on the community of that policy once it has been adopted and implemented? So this is coming back to from health impact assessment to health and all planning. This is a little bit complex again, but I wanted to illustrate for you how the integration and consideration of health can happen at any step of the planning process, whether you're at the visioning stage and you're working with the community to develop a vision statement, or you're at the implementation phase, or at the phase where you're considering plan revisions and adjusting what your plans and policies look like. At each stage, no matter where you're at, you have the opportunity to bring a health lens to the questions that you're thinking about. So priority setting, when you're setting goals and objectives for a plan, bring up health, clarify with the community what health means to them and what their priorities are. Ensure that health and equity are included throughout the plan's goals and objectives. Sounds kind of, it could be superficial, but also just having that language in there, bringing that up with the community is so important for raising this issue. And so when you have more time, you can look at this graphic and think about different ways that you can integrate health no matter where you are. And it doesn't have to be in the form of health impact assessment with all of the process of HIA. It could simply be bringing up health, bringing some health data into the picture, assessing potential health impacts based on what you know about the community, and ensuring that the processes and the timelines reflect the health and equity values that the community is asking for. So here are the 3 products that we produced: the report, which I went through some of the results of the report, and the toolkit. And then we also produced an issue brief, which is meant for decision makers or non-planning professionals. It's a 6-page document just explaining the values of health impact assessment to planning and to planning decisions that was produced in collaboration with the Health Impact Project at Pew. So all of these are available on our website at that link above, and just came out last year, so very fresh information. The last thing I want to mention is that we do have a Healthy Communities Collaborative at APA. So if you are a member of APA or not even a member of APA, because it's a network of both members and non-members from the public health field and other related fields who are interested in or actively working on planning and health issues, we do have this interest group within APA, and I would be happy to talk about getting involved. We'd love to have more people involved in the interest group and in the collaborative. There's my email address, so if you are interested in doing that, feel free to email me, and I'll pass it on to Jackie now for learning about Kane County.
Hey everyone, thanks for having me today. I'm happy to talk about our HIA that we've done in Kane County. Let me pull up my slides here. the beginning, sorry. Okay. Again, I'm Jackie Forbes with the Kane County Division of Transportation, and as a reminder, I did work for the Health Department for several years before I started here in the Transportation Division, so that's how I got my start in learning about HIA and actually conducting a couple of them. So today I'm going to talk a little bit about what did we study and why did we decide to do an HIA and what were we looking to do as part of this. I'm going to do an overview of HIA, but try and talk specifically about our HIA Growing for Kane and how we went through some of those steps of HIA to get this work done. And then I'd like to talk about some of the implementation that we've been able to do post-reporting of our HIA. We've finished it and we've done a lot of work since, been able to acquire some funding. So I'm going to talk a little bit about that, about how you can keep going with your HIA even after you're done with your reporting phase. And at the very end, I'm going to talk briefly about another HIA that we have done that was much shorter than our Growing for Kane that is really straightforward, and I think it's a good example of a different type of HIA that you can do. So to start, I wanted to give you a background about Kane County. We're located about 40 miles west of downtown Chicago and are considered part of the Chicago metropolitan area. We have a population of about 530,000 residents, and we are the 5th largest county in Illinois by population. Looking at the map on the right, we have an urban corridor on the eastern edge of our county, flanked by the city of Aurora on the south, which is the second largest city in the state, and the city of Elgin on the north. As you can see, the western half of our county is primarily rural and agricultural. So we kind of have both worlds in Kane. We have our urban areas, and then we have areas where there's corn and soybeans being grown, and just a very different feel. You saw this slide earlier about the different steps of HIA. I just wanted to bring it back here and say that you can go through all of these steps, and this is a true HIA. However, there is no HIA police who are going to come and tell you that you are not doing every one of these steps. So when we were working on our Growing for Kane HIA, we did actually follow all of these steps to the T and produced quite a document. However, you can just take elements of this, like Anna was talking about. Maybe you just want to find some data and talk to some key stakeholders about health and how that might relate to your project. So the steps are here for you to follow, but keep in mind, even if you're taking a few of the steps, to try and just bring health into your project or your plan is a good idea. So one of the things we started with was we knew in Kane County that our residents were not eating enough fruits and vegetables every day. So this is from our community health assessment, and we can divide our county into 3 areas, north, central, and south. I'll draw your attention to the fact that this chart only goes up to 25%, so it's not like we're close to 100, but we can see there's a disparity between the central part of our county and the north and south as far as who's eating 5 servings of fruits and vegetables a day. We have a comparison of Kane County as a whole, the state of Illinois, and the United States. So we knew that we had a problem. People were not getting enough fruits and vegetables. We also have something in Kane County called our Farmland Protection Ordinance. This ordinance was approved back in 2001, and it gave the Kane County Board the authority to buy or accept donated development rights from landowners on a voluntary basis. It's really a way for us to preserve the agricultural feel of our county, particularly on that western half where I showed you on the map. The owners extinguished their rights to keep this farmland under an agricultural conservation easement in perpetuity. So forever, they cannot sell this land and it cannot be developed on. I'm sorry, they can sell the land, but it could not be developed on at any time. So we have this ordinance, and we were working together, the health department and our development and community services department, talking about these different things. And we have all this great agricultural land, but we don't have enough fruits and vegetables that our residents are consuming, and what can we do about it? So we have some ideas. Here's just a little bit more about the Farmland Protection Program, or how many acres we have been able to protect, and 30 different family-owned or operated farms are participating. But we know that most of those farms produce corn and or soybeans for the global market. So again, not really growing fruits and vegetables that would help the health of our residents. This is a different type of map that we have, and what it shows here is the blue area is really our urban corridor. The yellow area we're calling our critical growth area, where we kind of have that transition. Some new subdivisions are going in, and the land is transitioning from agricultural to more of that suburban feel. And then we have our open space. So what we thought is, why don't we broaden our farmland protection program to include the parcels in all locations and all sizes in Kane County. It doesn't have to be out in the western half. And then we want to prioritize farms that can go in this program that produce fruits, vegetables, meats, and dairy for local consumption. Maybe that will help provide product for our residents to eat and increase the amount of fruits and vegetables that they consume. So we are fortunate the two departments worked together and applied for a grant from the Health Impact Project. And we did receive one for $125,000. Again, this is a joint project between the Pew Charitable Trust and the Robert Wood Johnson Foundation. They provided technical assistance for us. We had a dedicated project manager. We were invited to a grantee meeting at the Pew Charitable Trust in Washington, D.C., where we were able to really get an intensive overview of HIA and how it works. And in addition, they came out to Kane County and held a 2-day HIA training, and we were allowed to invite as many people as we wanted and stakeholders to learn about HIA, and then they provided access to tools and resources for us. So when we were thinking about this, what are some of the things that we could do to this ordinance that we have in place that maybe the HIA will help us decide upon? So one of the things we thought about was adding the use of term agreements in addition to the perpetual agreements. So instead of keeping land set aside for perpetuity, maybe just 5 or 10 years, and just so that land is being used productively. The current ordinance does not allow for that, only the perpetual easements. We also thought about prioritizing the farms that grow the fresh produce, meats, and dairy for local consumption to help our residents. However, the current ordinance was only prioritizing the farms in that western agricultural area that I showed you on the map. We wanted to expand the ordinance policies to include farms of varying sizes and in rural and urban areas. Most of the farms that are protected under the ordinance were much larger farms. We thought, what about a farm that's only 1 or 2 acres? They could grow quite a bit of food on that land and then also have that set aside and can take advantage of the program. And the current program only prioritized the large farms, close proximity to each other. We also thought about working with our local food bank, the Northern Illinois Food Bank, and maybe we could have farmers do pre-season contracts. They say, I will grow this many types of vegetables and I will distribute the product through the Northern Illinois Food Bank to those who might be more in need than others in the county. And it would be a guaranteed place that these farmers could sell their product. The food bank could take a donation, or perhaps the farmers would give them a good price that they could purchase it directly from them. That is not addressed in our current farmland protection ordinance. And we also thought about creating an increase in economic development, farm revenue, and jobs. So we have these corn and soybean growers who are currently on the program, but maybe if we had people who were raising fruits and vegetables and meats, dairy, that we could actually make an impact on our economic development and create jobs. And again, that is not part of the current ordinance. So what did our HIA examine? What were some of the health issues that we talked about? We talked again about that food access. Is that some of the reasons people aren't eating enough fruits and vegetables? We talked about nutrition, obesity, chronic disease. We even talked about the mental health aspect of having open space and something for people to enjoy instead of an urban setting. And then try to focus in on these economic tie-ins of job creation and increased food security for those in our areas that really were at risk of not having access to fruits and vegetables. We had quite a few partners that we brought into this HIA. The Kane County Farm Bureau was a key partner for us, giving us access to not only their members, but allowing us to reach out to their members at their leadership picnic that they held once a year, where we were able to do a survey with everyone. The American Farmland Trust worked with us on this HIA, helping us with some of the research, and we were also able to contract with someone at Iowa State University in the Department of Economics to help us with that economic analysis that we were interested in. Also, all the producers in Kane County we already knew, we were able to work out with them, have them participate in our surveys. We did informal and formal interviews with them, and also invited all these people to our HIA training that I mentioned. So we talked about the first step of being screening. Should we even do an HIA? Was this appropriate for the project? So these are the steps that we went through. We were kind of on our own timeline for this decision, whether or not we wanted to amend the Farmland Protection Ordinance. There was no deadline, so we were fortunate that we knew we had enough time to complete an HIA and then bring this to our Kane County Board. We knew we had the capacity to do that. We had 2 different departments willing to work on it. We knew that the information we gathered would help us with that decision-making process. If we could gather information from our producers, we knew that we could make recommendations and then present them to our board. And then also, again, looking at those health impacts, because we work so closely together, the Health and Development Department, we knew what the health impacts could be and what the current data was and what maybe some of the effects would be if we made these changes to our farmland protection ordinance. In step 2, in the scoping, we asked ourselves these questions. What do we want to get out of the HIA? And we said we wanted to know how to amend the current farmland protection program so it would be most beneficial to our residents. What are the best ways to do it? What do the farmers want? What would help them? We wanted to see if the amendment would change any behaviors, and we decided to add a health equity component to this. We knew that areas in Kane County we have low-income areas in Kane County that people are having a harder time accessing fruits and vegetables. If you remember the chart I showed you, the north and the south areas of the county, we had less consumption, and those are the concentrated areas of our low-income residents. So we knew we needed to examine health equity. We wanted to know about what are the issues. Is it access to produce? Or what are the obesity rates? Would this really decrease any health disparities if we tried to equalize the access to fruits and vegetables? We went through creating our research questions. What crops do we want to try and grow? Which ones should we grow in Kane County? And what are the barriers? Who should be involved? We went through decisions on who we should reach out to. And then we developed the pathway diagram, which Anna gave you a couple of examples of what those are. They look like a logic model. And I'll give you a couple of previews of some that we have. And it really shows you those links between the decision and how it affects health. So for this one, our pathway diagram, we had our proposed changes that we were going to change that farmland protection ordinance. We wanted to encourage local food production and maybe look at the farm size and location as some of the things we wanted to change. As far as the health impacts, we knew that we could make a difference in chronic disease, things like diabetes, hypertension, cardiovascular problems, and even child development. We talked about making sure kids get access to fruits and vegetables, which will help them focus in school and do better. So this is a very simplified pathway diagram. Ours is much more complicated, but you can see if we increase local food production, that would increase access and consumption of fresh fruits and vegetables, and which in turn would provide better nutrition for our residents, and then have an effect on obesity, chronic disease, hypertension, those other health behaviors and outcomes that people we were talking about. So that's kind of very simplified how this works. Next, we decided, okay, we have these questions we want to answer. How are we going to assess this? Our assessment step, we relied heavily on our technical assistance provider, our project manager, to help us do the scope, figure out exactly what our research questions are, what data we needed to gather, where we could find it, and really helped us through that. We did literature review. As I mentioned, we hired an expert for research health, both in the American Farmland Trust and Iowa State economic professor. We did a couple of surveys. The first one we did was via SurveyMonkey and email, and it was just to the producers asking them a couple of questions to get us going. And then we were able to do a long keypad polling survey at that Farm Bureau leadership picnic I mentioned, where we had over 100 people there, gave them keypad polling devices, and they were able to answer questions on the fly, things that we needed to know to help us craft that new farmland protection ordinance. We knew the key stakeholders in the county that we needed to reach out to, and we did a number of interviews with them. And then we also collected a lot of data from the Kane County Community Health Assessment, which the Health Department is required to do every 5 years here in Illinois. So that's how we were able to gather information. So I wanted to share a couple of slides that showed how important it was for us to get some primary data. We asked people at that Farm Bureau picnic, what are the barriers to local food production? And you can see that the biggest barrier, they said, was the cost of land, and the next was the cost of machinery and structures. These were things that we kind of thought about, but we didn't know that those were really the largest barriers that they felt were there. Also, labor availability was pretty high as well. So this was an eye-opener for us and showed a benefit of being able to reach out to them and get so many responses. Another question we asked was some good ideas that Kane County should pursue are, And the #1 response was allowing rental of public and government-owned land for commercial growing of local foods. So maybe that kind of went along our idea of maybe using the Farmland Protection Ordinance to do just easements for 5 or 10 years. Maybe it is government land that a village might own and is willing for 5 years to be a part of the program, and let someone rent that land so that they can grow local foods for our residents. They also said that they wanted to see us encourage procurement for local foods from the schools, governments, and other institutions, and then also look at tax credits for urban agriculture. So these are just a couple examples of some of the data that we collected during that assessment process. So then we had to analyze all this data, look at the literature, take all that data that we gathered from our surveys, and then we call them the findings. What were our findings? What were some of the predictions that we could make from this analysis that we were doing? How would that amendment to the Farmland Protection Ordinance actually impact the health indicators? And then we created our recommendations that Anna had talked about. So here, where we were making our predictions, what will happen, and we want to provide our decision makers and the public with the recommendations that are going to mitigate any of our negative health impacts that we may have found, with an alternative that might help support the positive health impacts. We want to address the community concerns before the decision is made, and then we want to reflect the broad stakeholder input. It's so important to reach out to the community and get as many people involved as possible, so you know that you kind of got as much information as you can to present to your decision makers. And then the key thing I like to remind people is that an HIA is not binding. You can present this to a village board or city council, and they might say, that's a great report, thanks, and not really take into account what you're presenting them. Or they might really look closely at what you did and base their decision on your findings and your recommendations. But some people think that they have to take it somewhere and it gets adopted and then they have to follow it, but they don't. It's really just providing information to your decision makers so that they can make an informed decision. These are some of the recommendations from our Growing for Kane HIA. We had talked about creating a separate sister ordinance instead of amending the current ordinance. Based on our research, that seemed to be the better option. Instead of changing what we already had and was working well, we would make a separate ordinance. We also talked about working with the Northern Illinois Food Bank to create a food hub in the area, because they thought that would be a good way for them to maybe get some of the seconds that the farmers bring to a food hub, and then they could redistribute that in their network of food pantries and soup kitchens. And we also thought that the Farm Bureau could assist farmers who apply to sell produce, meats, and dairy, and having things like a Meet the Buyer event where buyers of local foods can meet with the producers directly and talk about working together. So those were some of the recommendations. The final steps of our HIA was that we submitted our draft report with all the findings, recommendations. We had a plan on how we were going to get this report out through social media, through our Kane County Agriculture Committee. We talked about how we would do monitoring and evaluation as part of this. And then our decision makers were first the Kane County Agriculture Committee, which is a smaller committee, a subset of the Kane County Board, and they really helped us fine-tune a lot of the parts of the report before we brought it further. The Farmland Protection Commission, so our Farmland Protection program does have a separate commission. We talked to them about it. Again, the Farm Bureau, our full Kane County Board, and the public in general. I have a link there to the full report if you're interested in reading it. There's also an executive summary and then a copy of the evaluation that we had done on this. One of the things that is more difficult is how do you monitor your HIA? So these are some of the things that we had done. You can see it's the same format as our recommendations that we gave. So we said we should create and pass a separate sister ordinance. We gave it a date and a deadline, and then just like this, I presented it to the Agriculture Committee and said, yes, we did this in August 2013. We are working with the food bank on a food hub, and then we said we're in progress, and this is where we're at. And then the Farm Bureau assisting farmers who want to sell those produce. And then we held a Meet the Buyer event on this date. So this is a way that you can report out to your stakeholders how you're doing since the HIA was completed. Now I'm going to get a little bit into the implementation, which I promised. So what have we done with this report since it's been several years? Well, Again, I remind you that we conducted this jointly, the health department and the development departments, and one of the big recommendations was to study putting a food hub in Kane County or nearby. So we really moved forward on that. We did create a Growing for Kane group, which was based on our HIA. It will be a new source of farmland protection for those farms. We're going to do marketing, blog, grant writing, things that we're doing now. We did pursue a grant through the Plan for Health initiative. We did receive that funding, and we worked on the food hub with some of that funding. So it was great to be able to continue to move forward on that. And then the interdepartmental partnership has been key. We've been able to allocate time to work on this and continue moving forward on that. So we have broken this project for the food hub into different phases. You can see here in phase 1, we kind of have smaller amounts of funding that we started with to keep doing our research, and then we had that Plan for Health grant that provided $60,000. So we were able to bring in some other resource partners. We were able to hire a firm that specializes in food hubs and start some research on it and figuring out whether or not we could, did it make sense to put a food hub in Kane County. So I show all our different groups we worked with, including the funding. And then here's the project timeline and overview for phase 1 and for phase 2. So you can see we've really continued to move forward with trying to look at putting a food hub in Kane County and making sure that we keep reaching out to our producers, our buyers. We had another grower-buyer meeting. We looked at the business side of things. So the company, the consultant was able to put together a preliminary business model for us. We started really focusing in on health equity with our research consulting group. Still had some stakeholder meetings to talk to everyone about what we were doing and continue to move forward. So now I'm bringing us into the present and where we are at now. We have got to the point where we did a site search for food hubs in Kane County. We had a committee that was reviewing operator candidates, someone who would actually operate a food hub in Kane County. It would not be something that Kane County would do itself, so we had to look for an operator. The Ag Committee has reviewed the recommendation that was made in the MOU, and where we're at now is looking for our county board to authorize and sign that MOU so that the operator can come on. And then they will start really working toward opening this food hub. Doing some business planning. The consulting firm, again, will help the new operator with some of the research to get going and put together a business model. We're going to continue farmer readiness by holding a workshop. If you remember, some people wanted to look at the institutional buyers, potentially, of who could buy some of the food that was grown in Kane County, and we talked about how we at Kane County could address that. And our Juvenile Justice Center, which is the JJC, we thought that perhaps they could procure food from local farmers and serve it to the residents in the Juvenile Justice Center and improve the food that they're eating in there. We also worked on putting a garden in there where this past growing season we did have the residents growing their own vegetables, and it was a very small scale, so it wasn't something that they could bring into the cafeteria and actually serve everyone, but they did think about different ways that they can ramp up their scale and actually take local fruits and vegetables. So that's pretty exciting. And you can see hopefully by summer of 2018 that the operator would be ready and purchase equipment and be on getting really closer to opening up a food hub in Kane County. I wanted to mention again that health equity component. When we're talking about health impact assessment, you really have to look at all different aspects of health, and health equity was key for us to take a look again how that food hub could play that role in our community, helping all of our residents. Food hubs are already doing some of this by donating to food banks. So like I mentioned, if we have a food hub, some of those goods that are brought there by producers could go to our food bank and distributed in Kane. We could partner with our schools in Kane County that have higher free and reduced lunch rates and try and get fresh produce to them and help those students that are in greater need so that they have access to fruits and vegetables. And also looking at a CSA program for low-income communities and worksite wellness programs. Maybe we could provide discounts so that people would have an easier access to receiving a box of fruits and vegetables each week or every other week as part of a subscription, and then giving them discounts so that they can actually have access to the food and improve that fruit and vegetable consumption that we talked about in the beginning. So with that said, that was really a long, comprehensive HIA that we did. It took us about 18 months to do the Growing for Cane HIA. As I mentioned, we really followed every step of the process to a T. And I wanted to briefly talk to you about a different type of HIA we did. This would be more considered an intermediate. We didn't really collect any primary data. As part of this HIA, we did key stakeholder interviews, brought together several times a group of people we felt needed to be in the room together to talk about this. So the village of Carpentersville, which is in the northern part of our county, has an intersection that has a three-way stop sign, and unfortunately during rush hour the traffic is tremendous here. It's one of the few places where you can cross the Fox River in Kane County, and so there's a lot of people that use this road. It's unsafe for pedestrians and bicyclists. If you look at the picture there, you can see there's some buildings. There was a pedestrian that was struck by a car not long ago. So the village was trying to decide, do we put in a traffic signal here or do we put in a roundabout? And they thought, let's look at the health impact of each of those decisions and what that might mean for our community. They knew they were going to get rid of the stop signs, but they had an idea of they could try something different with a roundabout. So we were able to partner with the Chicago Metropolitan Agency for Planning, or CMAP, which is our regional MPO, and help us do an HIA. So we had no funding to do this, unlike the last HIA I just described. It was just technical assistance from CMAP, their resources that they have, and we looked at things like air quality, traffic conditions, and then again at safety for vehicles, pedestrians, and cyclists. What could we do if we did, say, put in a roundabout? How can we make it safer for pedestrians and cyclists? So those are some of the things that we put into the report. At the bottom there I have a link to the full report if you're interested in reading about it, because it is kind of a very cut and dry decision. We were able to bring people together and get this done really in about 6 months. We came to the trustees and presented it to them. They did choose to go with the roundabout, and they are pursuing funding right now to try and get through the construction phase. They are done with phase 1 and phase 2 right now, so they're very close to having everything ready to go for construction. Again, I wanted to bring this pathway diagram out because I think this one is, since it's an easier HIA, it's an easier way to see those connections. So the decision at the top again was that traffic signal or a roundabout. So what were some of the changes in behaviors that we might see? We might see more pedestrian bicyclists because they feel like they're safer if we do a roundabout or a traffic signal. What would be the change in recreational access, change in vehicle emissions, change in traffic flow? So if we did have a change in pedestrian bicyclist safety, would that make a change in physical activity? And if so, would that have an influence on obesity rates, chronic disease in the area? And then on the right side, you can see, would there have been a change in air quality? Well, that would have an impact on the asthma rates in the area. Or change in motorist safety would also lower injury rates if we were able to mitigate anything that would cause more injuries if we found that. So a pathway diagram is really just kind of a simple way to get from your decision to the health impacts and think of it more in a linear fashion. And it's also a good way to explain it to your decision makers. Finally, I wanted to alert you to this website from the Health Impact Project. Anna made mention of this. The Health Impact Project has a sort of clearinghouse of all HIAs that have been done in the United States, and it's searchable. I have the link there. You can say, I want to look at all the HIAs that were done by this person, like a state or a county. You can also do it by type of HIA, whether it was transportation or food, or maybe it has something to do with environment or water resources. And it's a great way to see different HIAs that have been done. If you have some ideas, but maybe an HIA that would be appropriate in your area, you can take a look here and see some that have been done and get ideas. And usually there's links to the full reports and all information about the HIA. So with that, I thank you for your time today, and I will turn it back over to Michael.
Thank you, Anna and Jackie. We will now move into the question and answer session. A number of people have been sending questions throughout the webinar, and we encourage you to continue to send them in for us so that we can ask them over the next 25 minutes or so. You can do that by submitting them on the web page there. So let's get started. So, and I will try to direct the questions either to Anna or Jackie, but some of them may be relevant to both of you. So maybe to start with you, Anna, do you have any examples of desktop HIAs that evaluate local comprehensive plans? And this is kind of a multiple-part question. If so, can these be handled by small planning offices? And are there tools that APA has to help local governments do an HIA on their local comprehensive plans?
So off the top of my head, honestly, I would have a hard time thinking of a specific rapid or desktop HIA on comp planning, but we could certainly look it up in the summary report on the state of health impact assessment and planning, which is the report that summarizes some of the data that I showed you, some of the graphic information that I showed you about where health impact assessment has been in the U.S. and identifies a number of different HIAs in different categories. So we actually have a very long table in the back of over, I think it's 28 HIAs of different types that assess different types of plans. So I'm almost positive there's an example there. And when it comes to actually doing it, I highly encourage you to refer to our toolkit, which really breaks down the different steps of HIA and the different types of data that you want to be looking for, the different partnerships and stakeholders that you want to reach out to. So I just actually sent both of those documents to you, Michael and Heather, about to see if you could potentially post them in the webinar as a handout. But if not, that link on our website, planning.org, if you look for health impact assessment, if you do a search for health impact assessment, you'll come up with both of those reports.
Okay, thank you. Yes, and I'll note for those of you who have been going to our website the last few days, we have been having some technical difficulties with the website, and it's, I think, currently down, but we're hoping to have it up in the next day or so. And on that website, we do have our webinar archives page, which we will go ahead and copy the recording of this presentation, but then anything that Anna and Jackie share with us, we can also post there for you. Excellent. So there were several questions that have come in about, I think, getting started and the cost and so on. So I guess to start that round of questioning, I mean, is it in the Kane County example that we've talked about? I think there was a very specific issue that prompted that assessment. Does it often take like a specific issue to get stakeholders recognizing that they want to do a health impact assessment and kind of coalesce around that idea? And I'll open it out to both of you.
Well, this is Jackie. I can try that one first. Yes, the grant for Kane was something that was kind of percolating, and it was something we were thinking about for a while, and that really helped bring all the stakeholders together. I'll contrast that with the Carpentersville HIA. The way that one came about, we partnered with CMAP again for this local technical assistance, and we did not have a project identified that we wanted to do an HIA with, or we didn't have one. So we decided to hold out to ask our communities in Kane County, does anyone have any ideas? And they brought it to us. Carpentersville reached forward and said, you know, we've been kicking around this idea for a while, maybe would this work? And that's kind of how that one happened. And I think there was some local concern because of the traffic backups, and somebody was having been struck by a car there, and it's right along a bicycle path along the river as well. So cyclists had expressed concern. So I think it does help if it's something that, if you're at a local level, people are passionate about, and it's a lot easier to bring them together. On this Growing for Kane, it was such a broad group of people, but they're also very passionate about their agriculture in Kane County, so it was easier to get them through. So I think it does help if you have people who are passionate about the idea that you have, and it'll make it easier, but also maybe you know something that might be a little more controversial, and that would also bring people to the table.
Yeah, I'll just add, I think it really does need to be something specific. If you're going to do an actual HIA versus a more general integration of health into the planning process, then it does need to be about a specific question so that you can collect data and look up evidence that have on studies that have been done on related questions, and it makes it a lot easier to scope the project.
Okay, so I think in your example, you gave us some of the cost factors involved and overall cost. How are these typically funded? And then, Anna, you mentioned at the beginning about how they've increased and how that may have been related to funding availability. Was there something specific in that 2010 to 2012 period that helped to get these off the ground?
Yeah, that's when the Health Impact Project launched, hosted at Pew, but with funding, collaborative funding from the Robert Wood Johnson Foundation. They were really interested in advancing this methodology, which health impact assessment originated in Europe and spread to Australia and England, and then came to the United States and Canada later on. So it had been used in the early 2000s in those other countries, and then came to the U.S. Sort of in the mid-2000s, and then by 2010, the Health Impact Project was beginning to exist and support HIAs around the country. And I think Kane County is an example of a very well-funded HIA. But I think that there's HIAs that have been done on very low budgets, and either they limit their scope to some of the most important key questions on health impacts in the most vulnerable communities that will potentially be impacted negatively or positively, because it's also important to note HIAs can illustrate these negative health impacts, but also the opportunities, as Jackie laid out, the many opportunities for enhancing positive impacts, and how just some small changes or alternative policies or alternative planning objectives could reach positive impacts instead. And a lot of planning, health departments rather, have been involved in leading HIA, and because health departments have a mandate to address public health in a directly all the time, they're often able to leverage staff, certainly data, but also staff and time to support HIA. And outside organizations often participate as well. So while those organizations probably do need a little bit of funding to support their time, I think you can do it if you piece together different resources and different capacities.
Okay, so I mean, as a planner who has been generally familiar with this, but not as specifically familiar as I've become through this webinar, I'm assuming that by having some of these successful projects that you're able at APA and through some of your other partners to kind of demonstrate the value of this type of work to other communities, correct?
Yeah, our hope with these reports was that it would illustrate how it's valuable, and also how, as I talked about, how the core values of planning are aligned with the core values of HIA. So it's not a big leap to begin to have a more of a health impact assessment, either formally or to informally think about the health impact assessment lens. And Jackie, did you want to comment on that as well?
Yeah, no, I think I do want to make one comment about the cost of HIA, because I hesitate to always put the cost of that HIA that we did, $125,000, because I think sometimes people think, oh, well, we could never do that if we don't have that kind of money. But I've had a lot of people ask me how much it costs, so that's why I do include it. But like Anna said, you really can do a lot of the work by partnering together with different groups. And you don't, like I said, the second HIA we did, we received no extra funding to do it. We just partnered with someone and we were able to do it. As far as how it, working together with your health department and it being a part of planning, you don't have to do the full HIA. You can do the pieces of it, and there's definitely value out there. When I was on the NACCHO community of practice for HIA, we produced a couple of documents. They're just one-pagers that show the value of how it really does help make your decisions a little bit easier, or just a formal way of bringing data to your decision makers to allow them to have all the information they need. Maybe they're hearing something from their constituents if they're in a local government level, but they also can get some actual real data and information that's been, carefully researched, and that really helps, I believe, to convince people that HIA is worth doing it.
Okay, so we have a specific question asked is whether APA has a media strategy to share these great case studies, and specific question that someone may want to follow up with you is, would you be interested in working with Next City to share these lessons learned?
Oh, absolutely. Definitely. They were released a year ago, and at that time we had a webinar and some of our usual dissemination through our various channels, our newsletter, and of course our partners. We shared it with our partners, and they disseminated it. As usually happens, you know, it gets fanfare at the time that it's produced and released, and then fades. So actually, this webinar was a wonderful opportunity to bring the information back into the forefront, and would love other opportunities to work with other publications to share the information. And they're really great, really some fabulous in-depth case studies. We talked to people who developed the HIAs in 5 different communities, and then read 27 more and summarized them. So we have a really good picture of how HIA has been used in planning.
Excellent. So kind of a follow-up in general to what you're saying, Anna, do you know of any follow-up HIA that has been conducted that measures health improvement, or are you aware of any long-term monitoring programs associated with HIAs?
So this is why Jackie's on this webinar. She's one of the Kane County folks are really one of the best examples that I know of a program, of staff who, I guess the other key note here is that the longevity of staff is always really important for this stuff, no matter what you're evaluating. And so to have Jackie be part of, even though she's moved agencies, to be part of the team still in the implementation and continuing application of the recommendations that they wrote up, I think is wonderful, and why Kane County is one of our go-to examples. Another place that's been doing good work is Oklahoma City, and as they had the plan adopted, and they were actually able to make the changes in the plan based on the results of the HIA. The HIA was very persuasive, not all of them, but it was very persuasive in shifting the focus from a more status quo, like, oh, we'll just assume that we have the same growth and we'll assume that we have the same approach, to thinking more sustainably about different ways that they could enhance their policies to change the shape of the city to be healthier. And the first part of the question was what?
Oh, I think you've answered it, actually.
Okay. Yeah. But beyond that, it is an area that we know is a weakness for health impact assessment, frankly, because of the capacity to be able to follow up. And I also think because of the selection of the types of indicators. I think that that's really key if you're going to do follow-up and monitoring later on, is having those key indicators that it's possible to do so. You don't have to do raw data collection again to find out where you're at.
Got it.
And Jackie, do you want to comment on that at all, the evaluation piece?
I think that when you're doing the monitoring, like you just said, going out and trying to get the new data to show if there's been any change, sometimes with health indicators, it takes years before you would see a change, even just based on when the data was collected. If it was 2 years old, you have to wait 2 years before you get new data, and then was any change, can you target that as something that you did for your HIA? And I think that is a challenge with monitoring, because you don't have to go out and get some more data, and then can you actually show that your HIA made the difference, the recommendations that you put in there. It is difficult. We, in Kane, because we have that agriculture committee as part of our board and meets monthly, there's an easy opportunity to provide them with updates. And because they were a key stakeholder, they actually want to hear the updates. So they do wonder what's going on, and we keep them informed every month of what's happening, and that makes it easier. But if you don't have that outlet yet, it can be challenging to do monitoring and say, oh, air quality is going to be improved if we do this, but you really won't know sometimes a change in an asthma rate for years.
Okay, so here's another general question before we get into a couple specific to Kane County. Do you have any suggestions on starting an HIA when you're looking for a local educational institutional partner? I assume you should reach out to your local health department.
you want to go, Anna?
I was going to ask you if you wanted to take it,
okay.
but yes, definitely is my short answer, but Jackie, go on.
Yeah, I would say reach out to your local health department, because chances are they are already collecting some kind of data. They might already know of some health issues in certain areas that they may not know that this potential project or decision is being made. So definitely reach out to your health department. As far as educational institutions, we did reach out to some local universities, some outside of Kane that we worked with, and that's helpful. Sometimes you can get some students to help out, either it's with data collection or helping you with some of the literature review. Definitely a good place to start, but I always encourage everyone to reach out to your health department and remind them of the importance of working together on a common goal.
Okay. So a specific question related to that is there an extension office in Kane County, and did you work with extension staff in any aspects of the projects through educational programs, workshops, and so on?
There is an extension office here. The University of Illinois has an office in St. Charles. We did work with them. They helped us in the Growing for Kane HIA develop a potential list of crops that could be grown in Kane County, what was really suitable to our soil type and our climate, and it was sort of verified by our economic development expert that we hired. Our extension office provided him with the information so that he could say, okay, if you grow these fruits and vegetables, this would be the economic impact. So yes, definitely they were. I may not have listed them as a partner, but we did reach out to them. As far as any specific workshops or education, I don't believe we have done anything specific with them. More of the work that we've done has been with our Farm Bureau.
Got it. So somebody actually asked if fruit and vegetable consumption actually has increased for Kane County residents.
That is an excellent question. It has gone up a little bit, not that much, but again, sometimes it has to do with it takes time to see the difference. I'm trying to think. We just completed an assessment. I don't think it went up very much, but our next scheduled health assessment in the county, I believe it will start next year. So we'll probably have results maybe late 2018 or 2019. And I think that would really show we've had enough time now to make some differences. We don't have a food hub yet, so we can't say that has changed anything, but we have some other initiatives that have been going on in the county that should increase that, but it is something that we're monitoring, and we actually, when we get the data from our health assessment, we do share it with the Ag Committee. So it's a very good question. It's something that's easily monitored because that's a question that's asked at a national level, state level, and then we ask the same question at a local level so we can compare.
Okay, so we'll ask a couple more questions as we're nearing the end here. And I guess we'll open this up to both of you. Can you elaborate more about the difference between integration of health into planning versus evaluating a specific plan or policy issue through an HIA?
Sure, I can start. So I think the question sort of outlines it. An HIA really is meant to be responsive after a policy or plan or project has been proposed. So an HIA specifically assesses something that is a question that is on the table before it has been either adopted or before it goes into implementation. It's an opportunity to change the language in the policy or the plan, to change the parameters of a project prior to that thing being adopted, versus an approach where from the beginning of the creation of a plan or a policy, you're thinking about how can we integrate health into this, and it's which I would describe as a more proactive versus reactive way to think about health in the community planning process, and the different populations that you need to consider, rather than having to react and potentially defend choices that you made that or your team, the planning department, made on how that plan took shape. So having health be part of the conversation from the beginning, whether it be at the objective, thinking about the objective, thinking about the vision, thinking about the populations, thinking about the physical places in the community where health could be addressed more fully or more directly, whether it be parks or schools or the street network, the circulation component of the community, or how it's addressed through capital improvement plans and policies. Is health one of the metrics by which a capital improvement proposal is reviewed to decide to move forward, is the potential health impacts of that. So, you know, it depends on where you are in the process. If there's already a plan on the table, then a health impact assessment is a way to get health into the conversation. If the plan is still taking shape, then you have the opportunity to be proactive about health.
Great, thank you. So we talked quite a bit about pathway diagrams, and I think that as a planner was very interesting because it sounds like that's really where a lot of the work takes place, both in terms of trying to understand the relationships amongst these issues and then how we're planning for it and focusing on the outcomes. Can you talk a little bit kind of briefly about how that kind of comes together? And I guess if you're also doing a planning process, I imagine that those two are pretty well integrated as part of the methodology.
I can talk a little bit about the pathway diagrams first and say that the way you create them really in an HIA comes from when you're in that scoping stage and you're thinking about what are my research questions, what are some of the health issues that could come out of this, and then so for my decision, how would someone's behavior change? And it's really in there. If you're doing scoping in the step, there is an Excel spreadsheet that's available on different websites where you can go in and actually put all this information in, and it kind of starts giving you all the information you would need to create a pathway diagram. When we did our Growing for Kane one, it was difficult to put all those things together, and we did rely on our technical assistance provider to help us get through it. But once you do it, it really is driven by your scope and what it is you want to research. There could be more issues that would be impacted by this decision, but sometimes you have to limit them, whether it's because you can't get data or you don't have enough time or the expertise, and so you make it a little bit smaller than maybe it could be. But through the scoping exercise is really how you're able to get those ideas to put in your pathway diagram. I think that's how it kind of is driven. I don't know, Anna, do you want to talk a little bit about how it would help in the actual planning process?
Yeah, I think it does, particularly when you're looking at the proximal, what we call proximal impacts or near-term impacts or intermediary factors of how the policy would change. So the one that I showed was about a mixed-use district, a mixed-use, walkable mixed-use district, and establishing that, and what are the mediating factors that have longer-term health outcome impacts on health outcomes. So having more sidewalks or more interconnectivity or more destinations. I think those are some of the elements that relate to planning most directly and that planners can affect. It's harder for planners to imagine affecting chronic disease or cardiovascular disease directly, but they do know how to affect the availability of sidewalks and destinations directly through plans and policies. So I think that's what the pathway diagrams can help illustrate, are the places where planners have a direct effect.
I think too, this goes back to, it is important to reach out to your public health department to get them involved. If you have, even if you're not doing an HIA, but you just have some ideas or you're doing a plan, because they can almost look backwards for you. They can think of all the health indicators that might be affected by what you're working on, and they can say, hey, wait a minute, but did you know if you put in the sidewalk here a quarter mile away, people are more likely to use it than not. And if you think about, the American Planning Association sends out a lot of information helping planners integrate health into their planning work. And then a counterpart is the American Public Health Association, sending out emails and information to public health professionals about how they should reach out to their planners, their transportation planners, land use planners, and work with them and truly try to bring everyone together that way. So I'll just put another plug in there for reaching out to your public health professionals to help you to really see from your decision all the way through those health indicators.
Definitely, I completely support that.
Great. Well, thank you both, Anna and Jackie. We're going to have to wrap up now because we're nearing the end of our period of time for this webinar. So this will conclude our webinar using health impact assessment to improve our communities. I'd like to give a big thank you to both Anna and Jackie for a great presentation, and for all of you who attended it. We unfortunately were not able to get to all of your questions. However, the complete recording of today's webinar will be posted on smartgrowth.org, and you'll be able to find it on our webinar archives page. Just as a reminder, when you exit from today's webinar, you will be asked to participate in a short evaluation. Please take a few moments to provide feedback so that we can continue to improve the webinar experience for you. Thank you, and we hope that you will join us again very shortly on November 14th for our webinar on EPA's Healthy Places for Healthy People program, and I will remind folks who've been part of these that you get the CM credits by participating in the live webinar. So please keep an eye on smartgrowth.org and our weekly e-newsletter for details on other future webinars and information. Thank you very much.